My name is Aubree Armstrong, and I am currently a freshman here at the University of Cincinnati, where I am studying communication design. But a little bit more of like my personal history. I've always had like sweaty hands pretty much like the majority of my entire life. I think I really noticed it when I was like in middle school, I want to say. My uncle has previously had like he had sweaty hands when he was younger, and so I thought there was some sort of like inheritance from that, but he tend to grew out of it when he was older, and so I was always questioning why I had sweaty hands, and I never knew like an answer. And so finally, like whenever I would schedule like dermatology visits with my mom, I would always go there and my dermatologist would say like, "Oh yeah, you just, you have sweaty hands, but there's nothing, we can really do." I think at one point brain surgery was brought to my attention, and for some reason it was like they have to go in and, I don't know how like the process necessarily worked, and I was just like that terrified me because I was like, "You mean to tell me I have to have brain surgery in order to get like, not have sweaty hands?" And so that just amazes me to this day that like not a lot of people are like even like medical staff and like dermatologists like aren't aware of like hyperhidrosis. And so that's when I really started to notice it in middle school, but it really had a big toll on like my mental health and physical health in high school, really. I think that's when it really like started to like I noticed it a lot more and I wanted to like take action against it.
Yeah, and was high school when you sort of went to your parents and brought it up, or did your parents bring it up to you like, hey, let's figure this out? How did
Yes.
start into treatment begin?
Yes. So I like would always like I don't want to say like complain, but like that was kind of the word. Like I would just like always be like sad and I'm just like I don't understand why I have sweaty hands. And so it all started when one night I went to practice, my swim practice back in Fort Wayne. And I was like getting ready for swim and I was like putting on my cap, and my swim coach noticed my hands and she was like, "Oh my gosh, like what is like are you okay? Like do you need to see a doctor?" And the main part of it was when I had sweaty hands, like before I had surgery, my hands would get extremely red. And so it like whenever I'd go out into public, like I even have a picture, but my hands would literally be like red purple, and it would just be like really awful, like the coldness along with like the sweatiness. And so when my coach asked me about it, I was just like, "Yeah, I just, I have this like just sweaty hands and I just don't really know." Like I thought it was like Raynaud, I think it's Raynaud syndrome or Raynaud, yeah, something like that. But I thought that I had like that along with this. And so that night I came home from practice and I was just like crying to my parents and I was just like, there has to be something. And so ever since that night, I did like continuous research on like my end. And I remember like just one night, I think my parents were out and I was looking at like all these YouTube videos and researching. And finally, I came across a Center for Hyperhidrosis video where I saw it was like this. I think this moment was like 9 years back. And so it was like an older video, but I had seen this girl who had like talked about her condition and like, she showed pictures. And I was like, wait a minute, that's exactly what I have. And so ever since that night, I texted my mom. I was like, "Hey, I really think we need to check out this place in California." There's this surgeon named Dr. Basseri who like performs these like surgeries for like hyperhidrosis, and that's like what my condition was. And so I got super excited, and from that moment on, it was just made up a following follow up appointment, and um, from that moment on, I like knew what my condition was, which was amazing because I had never known if it was something or if it was just me. Like I felt like I was the only person in the world to have it, and so it was crazy.
Which is so crazy because you were going to the dermatologist and everything, right? And they were like, brain surgery. Like,
Yeah, like even like besides dermatologists, like I would go to like my physician and she would just say like, "Oh, just the sweaty hand still." And I'm like, "Yep." And I'm like, "There's nothing I can do with it." And I even have, I think, I don't know if it has like a correlation at all, but like my like skin will get like very like veiny and like splotchy at times too. And like that would always like when I would get really sweaty, like that would happen. And so like I feel like that kind of had a correlation. So I would always be embarrassed to show like my skin or like hands to anyone. And so I just like that still like amazes me how like so many, like I said, medical professionals, like they don't even have a clue of what it is.
Yeah, and did you ever try anything, any other treatments prior to having surgery?
So I was, I believe I was on this like one pill, like medication, but I can't remember like the name of it. And then I switched or I tried out this like cream. It's called like carp or like
Right.
carpe. Oh my gosh, when I say that does not work, and it's like hysterical because I like sometimes will still get like notifications or like videos on my TikTok, and it was like, "Do you like excessively sweat?" Or I even think it was like someone had mentioned like, "Do you have hyperhidrosis? Like this is gonna like fix it." And I'm just like, "Oh my gosh, like people like no, this is not gonna fix it." And that would be frustrating. And like my mom like told me about that product and I tried it out and she was like, hopefully this like is gonna help. And I'm like, no, I put it on, my hands are still like they're sticky now and they're like dripping and I'm like, this is awful. So that was like my main thing. I think that I like tried beforehand and I was like, this just doesn't work, so nothing's gonna work for me.
Right. It's so frustrating when you are trying what seems like everything and
Yeah,
it's working. I know when I was in that process of trying one product after the other, I tried like three different types of lotions and
yeah,
I tried the antiphoresis machine and like all this stuff. And it made me, first of all, feel like I had more of a problem because I was trying and it
yeah,
wasn't working. And so
yeah,
that's where I eventually hit the point where I was like, I'm done. I'm not trying anything else. And then I thankfully found surgery. But
yeah,
I think we all sort of hit this point where we're like, it's just me, or like,
yeah,
oh, well, four sweaty hands is not working for me. So mine must just be like really bad and
yeah,
nothing's. And it's like
yeah.
so frustrating and it's so sad
I
when
know, like, it's just when people or, like, even if you were to, like, go and, like, shake someone's hand and you're like, "Oh, sorry, like, I can't," or, like, close family or friends who, like, know that I have sweaty hands, that I'm very, like, sensitive about that, they may mention, like, "Oh, Aubree, like, I don't care, like, it's fine," and I'm like, "No, but it's, like, it's worse than you think." And yeah, I remember telling, someone, like, previously, I was like, "Oh, yeah, I have this, like, really bad condition, and I'm getting surgery for it," and he's like, "Wait, what? I have sweaty hands," and I'm just like, "No, but, like, I, like, actually have, like, there's, like, a name towards this," and so, I think it's just, like, really neat now, like, since my going a little bit further in advance, like, since my surgery, just, like, sharing my story with a lot of people. Like, there was when I was in high school, I was in this class, and I opened up with my instructor, who's now, like, a lifelong friend of mine, and one of my, classmates was, like he talked about something like he's been, like, really sweaty or had sweaty hands, and I would show him pictures of mine and he's like, "Oh, that's nothing like mine. Never mind, never mind."
yeah,
Um, but it's just really neat now because I have actually spoken like since sharing my story, I've had a couple people come to me and this one girl, I forget her daughter's name, but she is going through the Center for Hyperhidrosis to have surgery. So my story like inspired her and really helped her daughter and I'm just like that's like amazing. Like I never thought like my story or your story or like anyone's, really like touches people. And so it's just like super inspirational.
it's the most rewarding and like heartwarming feeling knowing
Yes.
somebody else is going to get that same feeling that you had when you
Yes.
dry hands. It's like there's just you can't put a price on that. Like it is so
Yeah.
rewarding.
But just like, I don't know, like it just kills me to think like if there's still people out there, which I know there are, but like, they're just like, I have no clue what I have. Like same thing how like me or like yourself felt. And it's just like that's why I think it's so crucial now to like be so open about it and like sharing because it's like we've mentioned, like medical professionals don't even know what this is. And I'm like, that just blows my mind. Like people have to know what hyperhidrosis is.
Exactly. So the day that you found the center, you found the video, sent it to your mom. Did you fill out the consultation form that day, or like did you take time to sort of process it? I know for me it was like, what
So
is happening? There's a surgery. What?
Yeah, so I was, like, so ecstatic that night, like, when I saw a video, I was literally just, like, in my room or bathroom, I think, and I was just like, "Oh my gosh," I was like, not I don't wanna say screaming, but I was, like, so thrilled, and I, like, called my mom, and I'm like, "Mom, we have to get on this," and I'm like, "Have you looked at the sky?" Like, she was at, like, a friend's house, and I was like, "Mom," I was like, "You need to drop every" I was like, "You need to, like, look into the sky, like, I think he's serious, I think he's legit, I think this place is, like, gonna be, like, really awesome." And so I was very on her and I'm like, "Mom, we have to like set up something. We have to get in contact." Like I took no hesitation. I was like the minute I looked at that video and saw it and just like the process and like the whole like experience of hers from the lady I had watched, I was like, this, I have to experience this. I have to go through this. So there was no hesitation on my end.
Oh, I love that. It's I still like to this day can remember the day that I found the center and replay that in my head.
Yes.
The movie, it's
I
amazing.
know, me too. I have that same, like, experience. I just, like, always, like, just think about how, like, that was, like, such a challenging time, like, beforehand, and now it's, like, I live on a day-to-day basis, and sometimes I don't even, like, think like, I remember sharing this post, like, when I got, like, my tattoo of my surgery date, and
Yeah,
I was like, "I never want to forget a day that goes by where I, didn't have this." Like, I always wanna be reminded of how grateful and, like, lucky I am to have received this, and so it's like truly like amazes me still to this day that that happened.
yeah, that literally gave me chills. I'm
Yeah.
the same way, and I'm very fortunate to be working in this every day where I can't forget about it. You know, I get to talk to people every day where they're sharing their stories and they're still living it right now. And I'm like,
Yeah.
oh my gosh, like I'm
That
so excited for you. Like it's amazing, and I know you know that
yes.
feeling. Um,
Yes.
we'll fast forward a little bit to your phone call with Dr. Basseri. So you fill out the consultation. You're like, Mom, this is happening. You have your call. How does that go? Did you go into it with a ton of questions? Sort of just
So
talk about that.
I definitely feel like I can't remember off the top of my head, but I definitely feel like I had a lot of questions to bring up to him. But I feel like when he explained everything to me, I didn't have to do any explaining on my end because it's like, like if I were to go to a dermatologist, they're like, okay, so like, what's this? Like, what are you experiencing? Like, he knows it all. Like
Yeah,
my condition is like what he's telling me. And so everything he said, like I just remember thinking like I was almost in tears when he was talking about it because I was like, you understand. I was like, there is someone out there that understands what I have. And I remember him telling me like exactly what it was. Cause beforehand I was just like, okay, sweaty hands. And like when I did research, I was like, what is this? Like, what do I have? And so it was very neat to like actually go in and like hear like about my condition and like know that it's like a real thing. And when he was explaining like the surgery to me, I was like just like in shock. I was like, wait a minute, so it's not brain surgery? I was like, I've been like lied to or something. I'm like it was just crazy. And like he was, telling me about the procedure and like he had brought up effects like afterwards of like, if you think of like your he had mentioned if you think of your hands right now as like a 9 or 10 out of 10, like how bad like sweating they are, side effects afterwards maybe like your back or stomach, could be like a little sweaty, but think of that as like a 2 out of 10. And so I have not really had like any big problems with that. Like occasionally like I'll get like hot or sweaty, but I'm just like I know that that's like it's normal. Like it's way more normal to feel that than sweaty hands and I would way rather have that. But it
yeah.
was just like going back to the call, like it was just so like honoring to like hear like everything and like I remember I was going into work and I had called my boss and I was like, "Hey, I'm gonna be a little late. I have this like a really important like meeting that I have to that I'm gonna go to." And so yeah, it was just like a dream hearing that. It was amazing.
I know, and it feels so validating hearing it from a medical professional.
Yes.
It's like, okay, so I'm not crazy, and like I know
Yeah.
it's not anxiety. I know it's not the heat. Thank you.
Yes, I was just like literally like what he was saying, I was just like I'm sure I was like smiling the whole time to my mom and I was like someone understands. I was like someone in the field is explaining exactly what I have, exactly what symptoms are. like primarily hands and feet is like, you know, what they like are dealing like giving the surgery for. And I'm just like, that's exactly what I have. I was like, all my questions like are literally being answered. So that was, yeah, so amazing.
So awesome. It's really the beginning of everything because you have that,
Yes.
and I feel like that call is really like, okay, so this is legit. This is
Yes.
what's happening.
I think the call was really like the first big thing that I was just like, okay, because like when I first found out, well, I would say this like the first big thing, like when I first found out about it, like the YouTube videos, I was like, okay, like I think this like is like what I like need. And so when I got that call, it was like that validation piece. And I'm like, this is it. Like I'm going through this company, I'm gonna get surgery and my life's gonna change from here on out. So
Yeah,
that was the biggest piece right there.
so awesome. And so then fast forward to your actual surgery day, sort of just talk about a little bit of the lead up to that. Like, did you have to fly in for surgery? How
Yeah.
was that process? And then surgery itself.
Yes. So I, like I mentioned, I live in Fort Wayne, Indiana. So it's a little far from California itself. But I was at the beginning, I was like, a trip out to LA, like Beverly Hills, like absolutely. And so the process went very smoothly for me. Like we didn't have any complications. I think the only thing that took time was just like getting like our insurance
Mhm.
set up and like, you know, communicative, like, you know, in LA and just like working all that out. But once that was like fully set up, like we got set up with a date instantly. And I remember I was at work one day and my mom called me and she was like, insurance went through. We have a date, July 21st. I was literally jumping up and down. I was like, oh, wait, no. Oh, my goodness. July 22nd. I can't believe I just forgot that. July 22nd. And like we had flown in on July 20th.
Mhm.
And so I was just like, it was just like such a great day. Like when I found out, like I was like, this is actually real. I was like, in 1 month, I'm not gonna have dripping wet hands. And I was like, how do I like take this? I was like, what if like my whole life is like gonna be changed? And like, you know, some may just look at it as like, you know, something simple, but to me, I'm like, this is literally life changing. And so when we flew out, it was very, very neat. Like we flew in on that like Wednesday, July 20th. And that next day we had a pre-appointment, like a follow-up with Dr. Basseri. So I went in and, you know, we talked about like the whole procedure and like how the next day was going to go. It was very quick. It was very simple, very easy. I got to meet like, you know, some of the staff and they were all very like welcoming and very nice and like supportive. And so I was very excited and I felt like the environment just as a whole was like very neat and very like I had mentioned welcoming. Like I felt like this was the place where I needed to be. I felt completely comfortable and so that made it a wonderful experience. And then fast forward the next day where my life actually was going to change forever was a great experience again. I, you know, walked in the morning. I think it was when did I go in? Like 8 or 9 in the morning, and then I had my surgery at like 10, and it was literally like a 45 to an hour procedure. It was like the smoothest thing ever. You know, I went in and they like put me up like hooked me up with like an IV and everything. And so I was like, I'm always like a little afraid of needles, but it wasn't anything bad at all. And so um I before I knew it, like I was already out and then I was up again and it was such like a neat like experience then, but I will say like my recovery, sometimes I'm like not the best in like dealing with like pain wise or, you know, certain things like that. But when I woke up, I didn't really have much like pain wise. It was more just like that my chest felt like really tight after surgery, but like he explained like that's completely normal to feel like just since they're like operating like underneath, you know,
Yeah.
um and like up here like on my upper half, it's just like you feel like really like tight like afterwards, but really like I felt some like pressure or like tightness just for like I did feel it for like a week, I
Mhm.
would say, but like every time I moved, it like definitely got better. And like every time I was up and walking, and you know, the medication that I was on to that they prescribe you is very, very helpful too. So that is very manageable. And really I would say that was like my biggest thing that I had. was just like that tightness in my chest, but everything else went very like smoothly for me. At first when I woke up, I was, I think, like a little bit like nauseous too.
Which is
Um,
probably anesthesia more than
yeah, anesthesia too. And so that definitely got me a little bit. But other than that, literally, like the main thing I think was like tightness. But, and I was like a little nervous about it. Like I think more leading up to it, like once I got there, I was just like, oh my goodness, like I knew this was the right decision for sure, but I was just a little nervous, like being
yeah,
in
which is
surgery in
totally normal.
general. But I don't regret it at all. And I was very nervous. Well, not very nervous. I usually, like, I remember thinking about it, I was not nervous like at all, like the whole like time like I, found out about this place, but it was more just like leading up to it where I was like, okay, like, I wonder how this is going to go. But anything, I was just, more than anything, I was ecstatic over it, and I was like, this is exactly what I want. And like I've never been so sure of something, and this time that came around, I was like, I know this is exactly what I want. So yes.
Yeah, yeah. I say the same thing. Like I would go through it 100 times over again, and luckily we don't have to. It's a one and done thing.
Yes.
If I had to go back like every 2 years, I would.
No, I think about that now too, and I'm just like, so I know with like some people just have like the Palmar hyperhidrosis, like with hands, but or the ETS, I think, is that
Yeah,
right?
ETS.
ETS, yes. And so I have had it like along with like my feet too, but my feet have been like pretty like not manageable, but like my feet, I'm able to wear socks and shoes and like no one, notices that. And so it's like I've been more like concerned and set on like getting my hands fixed. And so after the surgery, I know there was like I think it was like a very low chance, but that your feet could also be like cured through the hand surgery. Unfortunately, that didn't happen for me, but I was like, that's, I'm totally fine with that. I got like, what I wanted mostly. And I was just like, I'm forever grateful for that. And so me and my mom have actually been talking about next year going back to the Center for Hyperhidrosis and getting my foot surgery, which I would love more than anything.
Yeah,
And just knowing how like the process went and like the recovery, like I'm not scared to go into another surgery there at all. Like I know what it's going to be like now, which is really great knowing, because sometimes you go into surgery, and well, probably always, and like you're scared for how the outcome is going to be. But now it's like I'm completely like fine, confident, and I know like it's going to turn out very well, just how my hand surgery went.
absolutely. And I'm thank you for mentioning the feet because I was going to ask you about that. Um,
Yes.
and for patients that may be watching this right now, we've mentioned it in all of the interviews that we've done. Some
Yeah.
improve, some don't. I always tell patients if you're going in for ETS, which is the one for the hands, just
Yes.
be excited with your hands. Don't get your
Yes.
up about your feet because your feet may improve. I got very lucky. My feet improved drastically.
Yeah.
This patient that I interviewed after I've restarted interviews and everything, her feet also improved drastically. The
Yeah.
before you and you, your feet didn't. So it
Yeah.
really is like coin toss, luck of the draw with the feet. Um,
Exactly.
so you really have to go in focusing on, okay, my hands are going to be dry. And like that is the
Yeah.
biggest,
I
like,
think that is like really like my biggest thing that I focused on and that I'm like forever grateful for, because I know that like my feet still sweat, but to be able to even know like what my condition was, like if I hadn't had like my hand surgery or like I hadn't researched any of that, like I would have no idea, and my hands would still be sweating, my feet would still be sweating, like I would still be like I would not have any confidence at all going out in public or, doing like a job interview or like shaking someone's hand. And so I am like just forever grateful knowing that I was able to get one part. And if for some reason like I wasn't ever able to get the feet surgery, like I will still be forever grateful for my hands that I received.
absolutely. And that kind of leads me into the next question I have for you, which is career, academics. I know you're in college right now. How has the surgery impacted that aspect of your life?
Oh my gosh, it has impacted like drastically. Like I like think back of times now when I would be in high school, or I know I had mentioned this in a previous video we did earlier this year, where I participated, like our school would participate in like school like events that we got to like partake in. And so we would have to like collaborate, and a lot of them were like interactive. And so whether that be not necessarily like touching others or like touching hands necessarily, some were, but more just like your hands would like show in whatever activity you're doing. And I would like always constantly sit out. I'm just like, I can't do this. I was like, my hands are literally red. And like, I would never want to like let my team down or like let, you know, like one of my teachers who are like looking at me down. Cause I, you know, I was very like involved in my school, and but I didn't want this to be like a downside of me for not like participating. And even when it came to like presentations, I remember like I'm in this leadership program now, and when we met like some very cool like, you know, business professionals and got to meet with them, I would shake their hand and I would always have a constant fear. And I remember this one time when my volleyball coach, he would constantly give me a high five, and I would just say like fist bump. And I always think that's like funny to think back now, because he was like, yeah, that's probably like, you know, a good idea for COVID and all. And I'm like, yeah, yeah, COVID. Like we're gonna use that excuse. Yeah. But I'm just like, I mean, that's like always what I had to use. And I'm just like, I could never feel confident, or like whenever I would like, it would dictate like what clothing I wore, like what I was doing. Like I remember I even thought about like, so I was in an AP language class my senior year, so after my surgery, but beforehand, I knew that class was like fully writing paper and pencil. And I even talked about it like with my um I think like academic like advisor, like school counselor person. And I was just like, I don't really like want to like take AP Lang when like discussing classes, not because I didn't have like an interest in it, but I was like, I can't write on paper pencil the full time. I was like, my hands are gonna be dripping wet. I'm gonna have a soaking paper every time. And so it's just like little things, not even little things, but like big things like that that I think about. And I'm just like, have such a huge impact. And I remember, you know, I remember when I was in like a biomedical class and we would have to wear this. Oh, this was like my number one thing I hated, but like the plastic gloves that you had to put on.
About it.
Some people like they well everyone they'd just be able to like slip them on, and I'm like taking 5 minutes to like put on one glove because it's like sticking to my hand, and I'm like, this is so embarrassing. And then I'm just like, because I remember for the majority of my life I wanted to go into the medical field, and those were always things that like I thought about too, like when I'm wearing gloves or whatever, and I'm just like, oh, I can't do that. But more fast forwarding to senior years when I found my passion for graphic design. And so I was like, I know like working with like the laptop and computer and technology, you know, it still plays a very like crucial role when like you have like sweaty hands and everything. But luckily, um, when I got my surgery when I did was like the perfect timing. So it was like going into senior year already like stressful on its own when making like college decisions, and you know, just very busy. And so I had one less thing I had to worry about. And that was just like a huge, like, relief and like good thing to like know. And so now it's just like thinking about it like when I'm in college, like I can go into class every day, and like and some of my classes will do like a lot of like either like writing or like sketches and drawings of things. And so it's like it doesn't even cross my mind now that I have to like tuck in like my sleeve more or like hide my hands, when it's like beforehand, like a year ago, that's all I focused on. I was like, I could not, like, that's all my mind was consumed of, and like nothing else. And it's just like it amazes me how like that wouldn't even come across to anyone else. Like no one else would ever think of that, but like me, like that's just always what I'm like. Or I'd have to make like up excuse after excuse, and I'm just like, oh, like I just don't feel like working on this right now. And like I'm gonna go do it at home when I'm like alone by myself and I have like a million paper towels with me. But it's just such like a huge relief now, and like knowing that like I don't even have to think about like shaking someone's hand. Like when before I did, I would like my mind would start racing, and I'm just like, oh my gosh, like I can't do this. Like I what am I going to say to them type of thing. So
It's a gut wrenching feeling when somebody would like put their hand out to shake.
yes, I would panic always. I'm like, oh my goodness. Or like even like my family knew like my personal, like close family, and not so much like my extended family knew really what my condition was, but like whenever we would have family gatherings or something, and like maybe like we would like hold hands for whatever, and I'm just like, I don't think, like, I'll just pretend I'm like, have to go somewhere, or like I'll hold my dog for this, so it's like I don't have to like hold anyone's hand.
Right.
But it's just like things like that now, and I'm just like, that's just such, like, it's amazing to see how that impacted my life so much, and now it's like any activity I do, I would do like a normal person. Like, I remember thinking back to, like, oh my gosh, like my wedding day, like when I get married and I have to like, when I'm standing at the altar and I'm holding, someone's hands, and I'm like, what am I going to do there? Or like, just like when I get a job interview and I have to shake hands or anything like that. And now I'm just like, I can do that comfortably and confidently without even having to worry.
Absolutely. Diving a little bit more into that aspect of it, family and just relationships, friendships, have you noticed a difference in just your day-to-day confidence or your willingness to like go and hang out
Absolutely.
with friends, be with family?
Yes, absolutely. So I would say I was still always wanting to like do things, but like sometimes like when it came to like certain activities, or I even remember this. It was hard then in that moment, but when I took prom pictures with some of my friends during junior years, we wanted to do somewhere we were holding hands. And I was like, oh, I'm not going to like hold hands. Like, my hands just kind of going to be like, down by the side, and like you guys can hold hands and I'll just do like something fun with mine, type of thing. And so it's just like, looking back at that, I'm like, wow, like, and my friends knew that I had hyperhidrosis, but I don't think sometimes I didn't feel like, they obviously didn't think it was like as big as a thing as I did. And, they would say like, oh, I don't care. And I'm just like, no, trust me, you do care. Like, it's not what you think. And so, I'm definitely, I would say, like a lot more like involved and like present in things now, and like wanting to collaborate or hang out or do things. It never really like I had mentioned, like I would always still want to like hang out with my friends and family just because I'm a very social person, but like actually being able to like collaborate or like do interactive things together, I'm like way more confident in that now.
Absolutely. And I would say the same for myself too. And I word it now as I enjoy just getting to be present when I'm with people
Yes.
and not because before, if I was, at a social event, my mind would not be on that event. My mind, oh my
Yes.
gosh, my hands are sweating. I hope nobody notices my hands are sweating. Like a constant, like
Yes.
that replaying in my head. And I probably wouldn't have even really known what the conversation was because I was so
Yes.
focused on my hands.
No, that is like bringing up that point. Like, I constantly had that on my mind. Like, even like going back to like a school thing, I would always look at, I sat next to my best friend in math class, and I would always look at her hands. And I'm like, that kind of like may sound weird now, but I'm just like, your hands aren't dripping wet. Like, you are totally normal. And you're probably just focusing on like our pre-calculus work right now, like what we're being like taught. And I'm just thinking like, if my hands don't stop sweating right now, like this is getting out of hand. And like I would literally have to have like papers like fanning my hand like under the table, and then like me like writing with this hand and then like alternating. And I'm like, that's just so crazy to think about. I'm like, anytime like, someone would like introduce something, or, do anything like random, like my mind, like you said, never was focused on that. I'm like, it doesn't matter what it could be. I'm just focusing on like sweating, or like thinking about it beforehand, like, oh, I'm going to have a presentation and I know I'm going to have to shake someone's hand. And that's what I'm worried about. And so, if anyone, like, if I had talked to friends maybe, and they were like, I'm nervous for this presentation, and I'm like, I'm nervous for it, but not in the way you are. I'm like, you're nervous for like,
Normal.
talking to them, or like, normal anxiety for presentations. And I'm like, I'm gonna have to shake their hands. And I remember one year for a junior year, we were still kind of in like that COVID like
Mhm.
time where we were like all wearing masks and stuff. And I remember our teacher saying, like, due to COVID, usually you would go up and shake their hands before you present, but we're gonna eliminate that this year. And I'm just thinking in my head, this is the best thing I've ever heard. I'm like, yes. I'm like, you mean to tell me like, oh, I don't have to do that. Like, I'm just kind of like going all over right now,
Oh, I
but
love going
I
for
remember 8th grade year when we had like our like graduation from like middle school to high school. We had to like go across the stage and shake like our principal's hand. And even when I did that in junior year of high school, like I had received like doing like our academic like awards and everything like that. I had to walk every person that got one, walked across stage, shake their hand, took their award and left. And I remember like kept pulling down my sweatshirt because I'm like, oh my gosh, I can't do this. And so I just like think about that now and I'm just like, that's crazy. Like every single time I would do that. And I would always like hope that we didn't have to shake hands for whatever reason. I'm like, please say we don't have to shake hands and we can just like grab a picture and go or something like that. And I'm like, that's just crazy to think about now.
It's so amazing.
Yes.
I still like, I mean, I talk about this all the time and it still leaves me speechless. Like,
Yeah.
it genuinely just, I will never come to terms with how amazing it is.
Yeah. And I'm like, I just yeah, I think about that now and I'm just like, I truly so like kind of going like more personal wise, I've like wanted like a tattoo like for a while. Like when I turned 18, I was like, oh, I want to, just like get a tattoo. And I'm like, I want to make sure like it's meaningful though. Like I don't just want to kind of get like something and then I'll regret it later on. And so I thought about this idea and I was like, yeah, I think I could do that. And then in July it really stuck with me like this was like the most important time ever in my life that I've ever had and like something I will always cherish forever. And I was like, I want that to always be a part of me. And so like getting like the date of the tattoo on my arm, I was like, I'll forever like remember and keep this time like close to me because I'm like it was a truly like magical experience. And I just keep thinking to myself, like if I had never like worried so much or cared so much, or like all these emotions that I experience and like if I had never done the research I would have still had sweaty hands today. And I'm like it's just so amazing like people like you and like others who are like sharing hyperhidrosis and I'm like this is what people need. I'm like people need to hear stories from people and I'm like people need to hear that this is a real condition because it is. And there's people who don't know it and I'm just like this is crazy. So
Absolutely. Thank you for sharing all of that. I know
yes.
we already mentioned compensatory sweating a little bit. That is everyone's number one question. So if you
Yeah.
could just talk about that a little bit more, your experience with it. For anyone listening who maybe hasn't heard the term yet, compensatory sweating is basically sweating in other areas after the surgery. So
Yes. So I remember when like talking to Dr. Basseri about this, and I was not worried at all. I was like a little bit of sweating on like my stomach or back. I was like, that's not going to be like, I kind of wondered how that would go, like if I would actually have that or not. And there have been times where I've experienced that. And I've experienced some like, this is like kind of weird, but like in like my dorm room, sometimes I'll get like hot randomly, like when I'm sleeping or whatever. And sometimes I'll notice that like my stomach and back primarily get a little hot. But I think that could really just be like the condition of like the environment I'm into. But really, that's like the main thing, like where I have is like my stomach and like back. But I like to think of it as like, think of it like you're sweating like a normal person would when like working out or being in somewhere hot. Like this is what you're supposed to feel like when sweating almost. So it's like, it's still there, but it's not something that's like nearly as big as what your hands were at all. And so really it does not affect me at all. I'm never concerned about it. Like even in clothing that I wear, it doesn't affect that at all. It's so little that it's like we have mentioned, like if it's hot outside, like anyone could like sweat on their back or stomach, like if they're hot. And so that's just like my main area. Sometimes, like I've always had this before my surgery too, where like I get like thigh sweat sometimes, but that's just like I think going along with like still my hyperhidrosis that I've had. And so that doesn't like affect me in that sense, like after with the sweating. But it's nothing bad compared to what I had
right.
originally. And so it's definitely manageable. um, I feel like there was a time where I was a little concerned with that because I was like, I think the word like a trade-off kind of came to mind, but I wouldn't even think of it like that because I'd say like I think anyone who has had the surgery and who has dealt with sweaty hands could say having sweaty hands is so much worse than like the little bit of sweat that you would get in your back or stomach sometimes. And so completely manageable and something, yeah, I wouldn't even ever worry about having to go through.
100%. And thank you for sharing that. I think a huge misconception with it is the way the surgery was done in the past versus how Dr. Basseri does it. So
Yes.
compensatory sweating is different now. And that's why that call with Dr. Basseri, where he as a medical professional can talk about it, is so
Yes.
valuable.
Yeah.
Because the compensatory sweating, in my day-to-day life, I don't say I have compensatory sweating. I say I sweat
Yeah.
now.
Exactly.
I'm
Yeah.
sweating now.
Yeah.
Sometimes my legs will sweat if it's like really, really hot and muggy out.
Yeah.
I'm only sweating in a situation where anybody without hyperhidrosis would also be sweating. I'm never like
Exactly.
sitting
Like
here.
normal. Like, like if people go to the gym and work out and they're sweaty, like when someone who has had hyperhidrosis, they're like, "Oh, I don't even have to work out. I could be sitting in bed and I'm sweating." But it's like that sweat, it's not like a bad thing at all. It's still like it's like normal to do that. Whereas like hyperhidrosis like isn't, like just sweating like out of your hands. And so yeah, I would say one crazy thing that like would blow my mind now looking at it is like when I would see like the Center for Hyperhidrosis like TikToks that are created and things like that, and I would sometimes like look at the comments or like look at like other hyperhidrosis videos out there, and like I would just see so many comments like oh, don't do it, like you're gonna sweat in like other areas, or there's so many side effects, and I'm just like it's hard to like tell those people like because not everyone's going to look at this or read your opinion or whatever if you make a post about it, but like it's not bad what people like think. I don't know what I just said, but it's like there's so many like bad comments out there that are just like don't do this, you're going to regret it, like it's not like there's going to be worse side effects than what you have now, and I'm just like that's like the complete opposite. I'm like it's so like I'm like there may have been like concerns like in the past, but I'm just like now I'm like it's like the surgery is like worth it 100%.
Yeah, I think people forget sometimes things evolve and the surgery has evolved. And
Yes.
yes, in the past it was more invasive. It was, they would collapse your lungs. The everything about it was different. And
Yeah.
just I always encourage people, if you're interested in the slightest, have the call with Dr. Basseri. It's free.
Yes.
It's no strings attached. You have that call with him and you can decide, okay, this surgery is not for me, I don't want to do it. Or you can say, like, okay, that was really educational, interesting, I'm doing it.
Yes. Yeah. And I knew like from the minute like I even found out about the Center for Hyperhidrosis, I was like, I don't, well, obviously, like I would like to talk with him, but I'm like, this is what we're going with. I was like, if there's the slightest bit of hope that I don't have to have sweaty hands on a day-to-day basis and it's not brain surgery, I'm like, I'm going to take that. Like, I'm going to take that offer up. And so it's just, I think the call is like, everyone, if you have hyperhidrosis, you should experience it because I think it's very crucial, and it's even if you maybe aren't able to get the surgery for whatever reason, I think just hearing and being able to get a call and talk about with a medical professional that like this is real and like you're not crazy and like you're not the only one who has this is like very crucial.
Absolutely, very well said. So now after surgery, do you have any triggers that make your hands sweat? And when I say sweat, I know they don't actually sweat, but like get clammy, normal levels of clammy.
Sometimes I remember like right after the surgery too, which is like a normal thing, I should say, like kind of in like the recovery stage. My hands would get a little clammy and I would kind of get like nervous. And I remember like my mom always like messaging Dr. Basseri back like with whatever questions I had. And he was like, it's completely normal to have clammy hands after like the first few days, like completely normal. And so that obviously resolved. But now I would say there are times where like my hands make it like a little clammy. Like I deal with like really bad anxiety at times, which it is getting a lot better now. And like more manageable, but like, certain instances where I get like, very anxious about something, I might get like a little like I can kind of feel like warm, but it's not like clammy to where they like used to be at all. And I'm like, I'm still able to like shake someone's hand like if I needed without them being like, your hands kind of feel like, wet or like clammy or whatever. And so, but now I look at it as that, like, that's just like completely normal to me now. And I'm just like, people like without hyperhidrosis get clammy hands, clammy hands, like, you may still get that or like a little bit of sweating, but I feel like that's like completely normal compared to what you had like prior. And if anything's like better or like, you know, more efficient now, I'm like, I would take that up in a heartbeat. I'm like, to not being like able to have like dripping sweat hands like all the time, I'm like, I'll take that up any day. I'm like, a little bit of sweating, like that would never hurt me as compared to what I had.
Right. Yeah. So, same. It's just very like normal. Like if I'm
Yeah.
hot and say I'm like sitting in the direct sunlight and I'm holding my phone, or I've noticed it like
Yeah.
walk in the summer if I'm holding my dog's leashes, my hands
Yeah.
are a little clammy, and it's like just the slightest bit clammy, how like anybody's hands would
Yeah.
get, and it's only once in a blue moon, and it's really like
Yeah.
any reason where
I
the
feel like sometimes like if I'm holding like my coffee cup like with me, or if like when I'm walking to campus, sometimes I'm like I might be like in a hurry and so I'm trying to like walk fast and I have like stuff in my hands and
yeah,
it's you just naturally get hot. But like to me, I look at it as like that's just completely normal. Like it never crosses my mind where I'm like I'm the only one that's experiencing this right now. Like your hand, if you're touching like a hot surface or something, you know, it will start to get a little bit like, you know, maybe like airy or, you know, clammy, whatever it may be. But I'm like, that's like in my mind normal. Like people
oh,
go through that. Whereas before, I'm like, I was the only one.
it's
Yeah. Yes.
absolutely. And then to switch things over to my favorite part, which is how is life without hyperhidrosis? What are some moments that have sort of stuck out to you since surgery? And do you just feel more confident? Any special moments or things you want to mention?
Oh my goodness. I probably can't even count, but my life has just been a total like bright side since then. Like like the surgery wise, like I've still like experienced like hardships like with my anxiety and like, you know, senior year was like challenging, but I just remember like every day I always look at it and I have to think to myself, like, I am so grateful to have this surgery because like I look at my hands now and I'm like, they're not dripping wet. Whereas a year and a half ago, I could look at them and I'm just like, I see drip marks everywhere. And so it's like very important to me now. And it's like very rewarding. Like when I go out in public, what I wear, I can, you know, wear shorts and not have to, you know, think about like maybe like my like splotchy skin necessarily showing a whole lot when like my hands would always get sweaty and they, you know, it would show. And so or like I would go into class, like when I go into class now, I feel so confident and like being around others is like the most rewarding thing. And even like this is probably like small. Well, with someone who has hyperhidrosis, everything is like big. But like I remember like my car steering wheel, like I had to get like a cover for it. Like,
Yeah.
and I still use it. Just, I mean, I like it now, but I'm like, I had to get a cover for it. And like, whenever, like, if I had to take my parents' car for something, I would always have to take it off and bring it with me. And I'm just like, how are you holding a steering wheel right now? And like, your hands, like, they're just not sweating. I'm like, me, like, if I touch the leather of a steering wheel cover or like a seat, I'm like, it's going to start, like, it's going to be a huge trigger. And so I'm just like things now that I can do or like I don't know, like I feel like if I've been in a car with someone before and I would see them holding hands, I'm just like I could never do that. And I'm like to be able to do that is like huge in my mind. And I'm like that's such like you know, no one would ever like dream of that, but like someone with hyperhidrosis, the littlest things possible are like the hugest, you know, things in their lives now and differences. And so now it's like I can do everything that I've ever dreamt of doing. And it's like simple things now, like I've said, that like other people wouldn't consider, you know, ever taking into account for. But it's like I can go up to someone and give them a high five anytime. I can walk in the room and give someone like a handshake with them. I can do whatever. And I'm just like, that's so rewarding to be able to do that and to actually be like present in your conversation. Like how you mentioned before, like, you know, when you go in somewhere, all you're thinking about is, oh my gosh, my hands are dripping wet. I don't know what to do. And they're talking to you, and you're like, I'm not taking any of this in right now. I'm just trying to like not embarrass myself. And I'm like, now I'm more present. I'm like involved like senior year, I was like a lot more involved in like activities once I had my surgery. And like, I think now it's like something that's very rewarding is just being like a big advocate for it.
Mhm.
And like I'm so very grateful for the Center for Hyperhidrosis and you and like Dr. Basseri and like everyone who has just brought like attention to it and who is like truly changing lives. And I'm just like, that's like what I'll forever remember and like be grateful for. And like that's what like the biggest takeaway that I have. And like I could never like I always dreamt like when I was younger, always dreamt of having a life without sweating. And I'm like, I would hope that one day it would magically like be fixed. And I knew like at the time I'm like, I'm just always gonna have this. Like there's nothing I can do. And so it's so rewarding and like I'm just beyond grateful to be able to have had that procedure done.
I'm just so happy for you, and
I'm
just
happy for you. I mean, I'm happy like everyone that just gets to experience it. It's
I know
amazing. It's
it's
amazing.
absolutely a different life, and I don't say that lightly. Like
Yeah,
when I tell people that, I'm sure there's people that look at me like I'm crazy, people that don't know
yeah,
this more so.
yeah,
And it's like, no, I literally live a new life now.
yeah. Seriously.
Like
I
I'm
remember, yeah, yeah, I remember too, like obviously when I had hyperhidrosis, I was never open about it and like I never wanted to like, tell people of my condition, but it wasn't until like afterwards when I actually experienced the surgery and like, I'm looking at my hands and I'm like there's no amount, like there's no words that can be put into like how lucky and grateful I am. And so from that moment on, I was like more people have to know about this. And it's so rewarding because you're getting to touch so many lives that you never thought you would be able to. And for someone like I don't even know. It's like my dad's like cousin on like his side of the family, like she was the one who like contacted me because she had seen like a Facebook post that my dad had made about just like kind of my journey and how he's like, very proud of me and things like that. And so for someone to be able to like find that message and like reach out is like totally like it's like the best moment ever because it's you don't think that your story necessarily may like have a huge impact on someone until like you see it and I'm just like to give someone like a life that they have always dreamt of like by just like telling and sharing my story I'm like that's like the best thing ever in the whole world for me.
Yeah, it is so special. And there's most of the people watching this are going to be people that have not had the surgery yet. They might
Yeah.
be these where either they've had the call with Dr. Basseri or maybe this is the first video they ever came across. And
Mhm.
there's a surgery for this. What would you
Yes.
say to somebody who's watching this? Their hands are sweating right now. They are still very much in it and struggling. What is your message to them?
I just want to tell people that you are not alone and you may have heard that term like a lot of times from people or people who are just like no, I get it like, no you don't get it type of thing like in a respectful way, but it's just like I just want you to know that everything like that you're going through is like so many other people have had to go through as well and it's just like you are truly not alone and my best advice is I don't regret a single decision about the Center for Hyperhidrosis at all. Like if you are able to get the surgery and you are, kind of like going like back and forth, like, do I want it? Do I not? There is truly like when I say this from the bottom of my heart, like nothing to worry about with the surgery. Like it was such an incredible experience. The company is like outstanding. Everything like that they communicated, communication was so clearly between me and Dr. Basseri and the company and like the whole process went very smoothly. And so I am just beyond grateful to have that. And I hope that, everyone with hyperhidrosis is able to experience the same situation that I have and that you have getting to have this wonderful opportunity in your life. But most importantly, too, even if you are not able to get the surgery for whatever reason that may be, um, everything will work out, I hope. And just to really know that you are not alone because I definitely at a time in my life, my whole life before I came across the Center for Hyperhidrosis, I always thought I was alone and I never had anyone to talk to about this. And so being able to like know that there is a company and that there is a condition and a surgeon who can cure your hands, I feel like just having the hope of like I'm not going crazy, like this is an actual thing is so amazing to know and understand. And so I just want to leave people with that and know that they're truly not alone and that everything I hope would work out for them and to experience the Center for Hyperhidrosis because my amazing and like yours, I think is so great.
Thank you so much, Aubree.
Of course.